All right, welcome everyone to this rapid fire explainer. Today, I'm throwing on my exam coach hat because we are tackling one of the absolute highest yield basic science topics on your Certified Surgical Technologist exam. We're talking microbiology. We're going to take a massive mountain of information and condense it down into just the core concepts you actually need to know. We're skipping the fluff, right? We're focusing exclusively on high-yield mnemonics, unbreakable OR rules, and exactly where the test makers are going to try to set traps for you. So get ready for a fast-paced, high-energy review that's going to have you walking into that testing center with total confidence. Here's our cheat sheet roadmap for today. We've got 5 stops. First up, microbes and pathogens, then sterilization and disinfection. After that, we'll hit defeating surgical site infections, followed by OR environment and safety, and finally, we'll wrap up with a quick sprint through high-yield exam pitfalls. Starting right off with Section 1, microbes and pathogens, our invisible enemies. Okay, let's dive into this. Understanding these microscopic threats is literally the foundation for everything you'll see on the micro portion of the CST exam. You can't defeat the enemy if you don't know exactly what you're up against.
Now, you want some easy free points on test day, you gotta use this simple mnemonic. Whenever you see gram-positive, I want you to think of the letter P. Positive equals purple, equals a pretty thick peptidoglycan wall. It's a really robust, thick structure. On the flip side, gram-negative stains pink or red. Now, these have a thin wall, but watch out, because they carry this nasty outer lipopolysaccharide membrane. When those bacteria die, they release endotoxins, which can trigger fever and even septic shock. So just remember your P's, and you'll always keep them straight. Let's put you right into the exam environment for a second. Imagine you're sitting at the computer, you click next, and bam, you see this classic question. Which pathogen is the absolute #1 cause of surgical site infections? Take a mental beat here. And boom, the answer is Staphylococcus aureus, and specifically methicillin-resistant Staphylococcus aureus, or MRSA. The exam absolutely loves testing MRSA because it is a huge healthcare-associated infection concern. In the real world, this often means preoperative decolonization with chlorhexidine baths and nasal mupirocin. So if you see SSI pathogen on the screen, your brain needs to instantly jump to Staph aureus. Major pitfall alert right here. The exam is definitely going to try to trick you by mixing up droplet and airborne precautions. The absolute key here is the 5 micrometer cutoff. Droplet precautions are for the heavier particles, so greater than 5 micrometers, like influenza or meningitis. Because they're heavy, they drop to the floor pretty quickly, so a standard surgical mask works fine. Airborne precautions, though, those are for tiny droplet nuclei less than 5 micrometers. These things literally float in the air. This is your tuberculosis. For TB, you absolutely need an N95 respirator and a negative pressure room, so lock in that 5 micrometer cutoff. And this brilliantly illustrates why knowing the exact characteristics of a pathogen is absolutely critical. The biological makeup dictates exactly how we eradicate them. Which brings us to Section 2, sterilization and disinfection, eradicating threats. All right, the exam heavily tests the Spaulding classification system. To pass this, you just need to mentally map the surgical item to the required processing level. Let's break it down. Critical items, like scalpels or joint implants, are going directly into sterile tissue or the vascular system, so they demand absolute sterilization, meaning we are killing everything, even the toughest spores. Semi-critical items, like endoscopes, they touch mucous membranes, so they require high-level disinfection. And finally, non-critical items, like a blood pressure cuff that just contacts intact skin, those only need low or intermediate level disinfection. The easiest trick? Just ask yourself, where is this instrument actually going inside the patient? Okay, listen up, because this next concept is one of the most common traps on the entire exam. Chemical indicators, like that striped tape that changes color on an autoclave pack, do not prove an item is sterile. I repeat, they do not. They merely prove that the item was exposed to the right heat or pressure. Biological indicators, on the other hand, use highly resistant, actual live spores. If you can prove those tough spores are dead, that proves actual killing power. Which brings us to this absolutely crucial quote. I want you to burn this into your memory. Only biological indicators confirm true sterilization. It is an unbreakable OR rule. When the test asks what guarantees an instrument is actually safe and sterile, the answer is always the biological indicator. Let's move right along to Section 3, defeating surgical site infections, protecting the patient. It's time to see how all those strict sterilization and asepsis rules apply directly to the person lying on the operating table. 60. You really need to remember this number.
Cefazolin is our #1 surgical prophylaxis antibiotic, hands down. But to actually be effective, it has to be administered within 60 minutes before the surgical incision is made. Now, there are a couple of rare exceptions the exam might try to throw at you, like vancomycin or fluoroquinolones. Those get a 120-minute window. But for standard prophylaxis, 60 minutes is the golden rule. Defeating SSIs is all about a bundled approach. First, you give those antibiotics on time. Second, apply skin antisepsis, like chlorhexidine, and crucial detail here, you must allow it to dry completely. Third, if you have to remove hair, use clippers. The exam loves to offer shaving as a distractor option. Don't fall for it. Shaving is always a wrong answer because it creates microscopic abrasions on the skin, which actually spikes the risk of infection. And finally, maintain normothermia. Keep the patient's core temperature above 36 degrees Celsius so their immune cells actually function the way they're supposed to. So far, we've focused heavily on keeping the patient safe. But what about you? Let's shift gears to Section 4, OR Environment and Safety, Protecting Staff. Up to 30%. Take a second to let that shocking number sink in. That is the risk of transmission per single needle stick injury for hepatitis B in an unvaccinated worker. Hep B is literally the most infectious bloodborne pathogen in the OR environment, far surpassing hepatitis C or HIV. Get this, it can even survive on dry surfaces for 7 days or more. This is exactly why things like the neutral zone, hands-free passing of sharps, and double gloving are so aggressively tested. They're your shield. You are 100% going to be tested on the aseptic technique golden rules. These are totally non-negotiable. First, sterile touches only sterile, period. Second, the edges of any sterile package, specifically a 1-inch perimeter around the edge, are considered unsterile. Next, the sterile field exists strictly above waist level. If an instrument drops below the level of the table, it is instantly contaminated. Do not reach for it. And finally, any wet barrier or strike-through means the item is contaminated. No exceptions whatsoever. Okay, let's amp up the energy for our final sprint. We've covered the core concepts. Now we are hitting Section 5, High-Yield Exam Pitfalls, Avoiding Exam Traps. These are the sneaky tricks that trip up even the most prepared students. Spores and prions are basically the ultimate survivors. Clostridium species form endospores that essentially laugh at standard chemicals. A huge exam trick is Clostridium difficile. You know it as C. diff. Here's the trap. Alcohol sanitizers are completely useless against it. You absolutely must use soap and water with vigorous hand washing. Then we have prions, which cause Creutzfeldt-Jakob disease, or CJD. Prions are misfolded proteins that are incredibly tough. They aren't destroyed by standard steam sterilization. Instruments used on prions require strict quarantine, total destruction, or an extreme extended steam cycle. Now here is a catastrophic trap that shows up on practically every single exam. The alcohol skin prep fire risk. Alcohol-based preps must fully dry and completely off gas before you place any surgical drapes or activate an electrosurgical unit. If the exam ever asks you about the danger of alcohol pooling under a patient's drapes, the answer is always a devastating surgical fire. Let's talk about immediate use steam sterilization, which historically was called flash sterilization. The test makers really want to know if you understand its true purpose. Sure, it runs unwrapped for 3 minutes at 132 degrees Celsius for non-porous items. But here is the massive pitfall. Flash sterilization is never a routine answer. It is strictly only for emergencies. We're talking about a scenario where a one-of-a-kind instrument is dropped on the floor and there is zero backup available. That's it. Finally, let's look at wound complications. Evisceration is a huge surgical emergency where abdominal organs actually protrude right through the wound. The exam will give you a big list of potential actions. Step 1 is always to cover the organs with a sterile, saline-moistened towel. Then, keep the patient supine, notify the surgeon, and get back to the OR immediately. The ultimate trap here? The exam is going to try to tempt you with an option to gently push the organs back in. Never, ever choose that option. I want to end on this provocative question to really lock in everything we've covered today. Think about it. If that autoclave tape turns black, but the biological indicator hasn't been checked yet, would you bet a patient's life that the instrument is actually sterile? Absolutely not. You now know that only biological indicators confirm true sterility. Keep these high-yield rules right at the front of your mind, watch out for those sneaky pitfalls, and you are going to absolutely crush the microbiology section of your CST exam. Keep studying hard, focused learners.